Good afternoon, everybody. We are live with with Lizanne van der Waart. Lizanne is from Wijnland Fertility Clinic. Good afternoon, and thank you for joining us, Lizanne. It's really an absolute pleasure to have you with us. And today we are talking about the psychological effects of going through fertility treatments or dealing with infertility as well. Lizanne, please introduce yourself to us. Let us know who you are, where you're from, and yeah, please.
Hello, I'm Lizanne van Waart. It's nice to talk to all your beautiful ladies out there. I'm one of the directors of Wijnland Fertility. I've been trained as an educational psychologist and got a master's in psychology with the topic of the psychological aspects of the fertility patients. But I think also the most important fact for me is that I've also been an infertility patient myself, and that was my biggest motivation to do this study, maybe to understand myself during those days. It's quite a long time ago, but I think it's fantastic to understand that it's quite normal to go through all these psychological aspects that's involved with infertility treatment, and that's what it's all about. So yes, that's it.
Okay. Great. Thank you for joining us again. And it's very important to go through this to actually, what Lizanne has actually mentioned is that she's actually gone through it herself. And I was just saying to her that it's very important to, or it's better to hear it from someone that's actually gone through it themselves, so they understand. And I'm very, very curious to hear what you have to say about it, because it's almost like you can see it you can actually talk to us from both sides of it. You're not just from the medical side, but you can actually speak about, from the actual emotional side of it when dealing with going through infertility yourself and as a couple as well. Yeah, so we're very interested to hear it. And I don't know if you should just, go straight into it. If you guys have any questions, those who are watching us on Facebook, thank you for joining us. We also, just to mention that we will save this on Instagram, Facebook, YouTube. All our videos are on YouTube, and you can watch all of them. And if you have any questions, Lizanne will give you details at the end of it, and you can contact her directly, or you can actually just post your comment in the comment section, and we will be checking over on Facebook all the time. So Lizanne, please tell us more about dealing with infertility and the psychological effects of it.
Yes, I think the most important things is that we must understand that we go through a psychological process. As soon as you've been diagnosed with infertility, there's something that happened on the psychology side. And all of us do go through the mourning phase of, mourning about that I can't have a baby, and that's something that I desperately wanted. And I think it's such important when doctors sit with you and you sit in front of them when they make that final diagnosis, to remember that it's going to be a psychological process, and you have to go through that psychological process as well. That's something that we can't stop. And I think sometimes for the outside world, people think, yes, we're going a little bit nuts. It's not. For the fertility population, it's normal to react the way that you're reacting. And I think that was the most important thing for me when I did the study in those days, that was the point that was coming out. Then also, it's very easy for clinical psychologists or psychiatrists to over and underdiagnose people during this phase, because if the hormones play a huge impact on your psychological status. And I think you must be very careful when you go to a clinical psychologist and they do not understand the medical process of infertility. The medical process of infertility itself plays a huge part on the psychological status of our patients. So I think that's a second point that's for me very important, that you understand it's maybe not pre-morbid, that I've been diagnosed with depression or anxiety. It is something that could be added or happen during my fertility treatment, and it's normal. I think also for me, to let your patient feel safe and that they understand that it is not abnormal. The psychological aspects, when we start with these treatments, in psychology, we have certain risk factors. We call it risk factors. That's the things for risk for anxiety, risk for depression, worry, and that kind of things. Then also with that risk factors, we had certain thought processes, how we internalize these risk factors as well. But then also from a psychological point of view, we do have protective factors, things that help us to bounce back. Not all of us have the tools to bounce back after trauma, but that's something that we can teach as well. And it's good to know that in the psychological status of our patients, there's more than one thing involved. So yes, with the infertility patients, with the specific simulation protocols that we use when we come to artificial insemination and our IVF stage, um, the the risk factors is symptoms of anxiety and depression. So there is a lot of ups and downs with the hormones as soon as we start with that medication. So that's normal for patients to feel very sad and can also be a little bit more aggressive. During that part, thought processes, as soon as you feel negative or had anxiety, that can be fear. I always say that fear could be start in a panic. Um, then there's like the intrusive thoughts, the things that we engage, we suddenly like get completely uncontrolled on unwanted thoughts. We will engage and say, I will never fall pregnant. I will never fall pregnant. And actually where you can teach patients, it sometimes feels like that. It's not always the word always. It just feels sometimes that you won't fall pregnant. Then with the protective factors is where we're looking at your happiness spaces. I think the only way to go through these treatment plans is where you also know that there's other things in life that can also make you happy. There's other purposes in life that can make you happy. And sometimes if you want to get out of this fertility box, go to places where it helps you to go to different focus on the happiness part, but you have to look at that and also sit and write it down. What is the other things in life that's important for you? And that helps you. That's why we call it protective factors. Help you to go through the process as well. From causes of infertility, I think sometimes doctors not always understand it or maybe don't think about it, but when your patient's sitting in front of you, different causes of infertility also will have an impact on how you feel and react to this. Men and women, different. So men also do have feelings, but they will experience it different and use different languages as that we're using. They're normally problem solvers. Male fertility had a huge impact on the couple, and that couple specific struggle more than maybe where there's female causes of infertility. But when there's female cause of infertility, like polycystic ovarian syndrome and endometriosis, but specific polycystic ovarian syndrome patients are higher risk for depression. And keep it in mind, because there's already a hormone imbalance. And sometimes, we said it, yes, this is now your chance. You go straight to IVF and now you're going to have this chance. I recently just noticed this again, and we will say to our polycystic ovarian syndrome patients, this is the best chance because you do have a lot of eggs. But we forgot that sometimes that potential eggs is not always good quality of eggs because there's already a hormone imbalance. So they're a little bit more at risk, and also how you're going to guide them through the process. I want all the patients also to know that not all of us need therapy, like normal therapy, like with a clinical psychologist. Not at all. It's only about 45% maybe of your couples that's sitting in front of you that's been pre-morbid diagnosed with a disorder to have more support. For me, the most important part is that you need and get support. Support is something else. People that can listen to you, understand what you're going through, support you, take you by the hand, little step by step. That's the only way to go for fertility treatment and help you through that. My last part that I think that also have a huge impact on the psychological state of our patients and our couple is the treatment plan. Still, we find that doctors think if you put somebody for 6 months on home plan and then for 3 months on artificial insemination and then get to IVF, it's the better phase. That's maybe a safer medical route, but not psychological, the best route for patients. It depends also there on specific patients. They can't do 3 artificial inseminations because they don't have answers, and that the kind of person that's looking for answers,
Yeah.
maybe is IVF a better phase for them.
Yeah.
Psychological, as you see, I've always said infertility have three main things that's important. This is a financial impact, psychological impact, and the medical impact. So I think when we do the diagnosis or work out a plan for our patients, is to consider both that three things, because that have an impact on each one of the couple that's sitting in front of you. So when we come, and I think that's where Leanne's questions is going to, is what can we do is the coping skills. I think all of us know what is the problem, but the biggest thing is for the infertility patient, we do have this problem. What now? What are we going to do? How are we going to handle it? How are we going through that? And again, I think, as I said, that's where sometimes old-fashioned clinical psychology, we go back to the things in the past. But I think with health psychology, with infertility, we have to live in the now. What's the most important tools that we can use to go through it? So I don't know if you want me to stop there, that you can ask the questions, but I think
yeah.
Yeah.
You're answering such a lot, and I'm listening to you, and it's like, wow, I'm hearing the other side of things now. It's really great. It's a very, very interesting topic. So my questions is, why is your psychological state important when dealing with infertility? Does it affect the treatment itself, as in, could it affect it as in giving a worse outcome and not, result in a positive, because of your psychological state and how you're feeling,
I
or
think
emotional state?
if we're just talking about anxiety can play a huge role, because it's where the stress factors is playing a role. I always explain to patients, if you got anxiety, as I said, it could be also go over to fear. Fear is more a more devastated situation which you experience yourself in, and then also you start to panic. And when you start to panic, that's a disorder already. That's where you're running into troubles, and that could have an impact on how your plan is going. So I think it's all about psychological status can have an effect on treatment plan.
Treatment.
Okay. Definitely. But we don't know how much. So that's why I said it's important to take your patients hand by hand and guide them through the process. That every day is part of your plan. We just always concentrate on the little eggs, then on the sperm, then on the embryos. Just everything you can be thankful, but it doesn't help when you only concentrate on the last part. If I'm going to be pregnant or not.
Yes.
Then you won't enter the race. If you know that answer, it was easy. Yeah.
So what are the risks of not dealing with the psychological aspects of it? Like, are there any risks? I think you almost answered that question with the first one. So I don't know if you actually want to say anything on that.
Always where you suppress some of your feelings and things, you must also understand in psychology there's a difference between feelings and thoughts. Thoughts is the things like hope is something that you make a decision on. It's not a feeling. So, and that's one of the things that patients struggles a lot. They feel, they think they must be over realistic or unrealistic about these treatment plans. It's not true. It's there must be a little bit of hope, but it's okay if you're not hope. It's about the feelings more that you needed to handle as well. So I think it's important to understand that the psychological status, even if you suppress a lot of things, it can come back in a different form. So suppress feelings and not talk about it and withdrawn from people is also not a good sign. So that's where the support groups and the support sessions could be very helpful. As soon as you get some of this stuff out, and outlet is always, there's a relief, psychological and physical. When you talk about things and you can get out the words, it's quite a relief, and it do have an impact on your physical status of your body as well. That's where mindfulness is such important, play a role.
Yeah, okay. You mentioned support groups, and I do know that Wijnland has support groups as well. So I don't know if you want to talk a bit about your support groups and get it out there for, especially for the women that is in the Cape Town area that
I
can
think
come and see that.
it's something that we recently realized that the need for support group is more than therapy and as I said, sessions with people. So the group sessions give girls a time to talk about their own stories. The infertility
Yeah.
patients want them to hear their stories. They don't want to hear somebody else's stories because we
Mm.
analyze things differently, even if we go through the same concept, but we internalize it, what the feeling of infertility is meaning for me is different to compare maybe to you. So people want
Yeah.
them to tell the space where they tell their own stories. I think try to teach people in the support group to look at things narratively. I always
Yeah.
say to patients, you can't take certain part out of your lives. That's part of your life. The
Yeah.
treatment is going to be part of your life, but we can try to look at it narratively and see what is the better things that we can take out of it. What's, as I said, that maybe give you a different purpose in life or the way that you will handle other things. I also said like system theories is one of the good concepts to use where we try to teach patients in the sense where you know that your life is more than infertility. There's like work, there's my relationship, how my husband's going to handle it. And I always said the system theories, I talk about the little boxes because that's this typical what the system theory is how you can put certain things in boxes and deal with that box and try to get to another box for the rest of your day as well. So the support groups is at the moment doing
Yeah.
really good because it's a safe environment. They just introduce themselves on their name, and we combine it with different things like making food, planting trees, do active yoga, oils. You know, we talk a lot about happiness hormones like your dopamine, serotonin, oxytocin. What is the simple things that you can do to
Yeah.
oxytocin, as everybody knows, your cuddle hormone. So cuddle a
Mm.
little bit more, and then you release a little bit more of oxytocin. Like your dopamine is maybe oils could help with that, and your dopamine and serotonin actually being reduced is being produced in your gut, in your stomach and that part. So, like exercise could be also a release of serotonin, and try to put a little bit more of these happiness hormones in. And then on the other side, your risk factors, the anxiety, depression would be a little bit less. So, a
Okay.
couple of things that we can do to go through the process as well.
Okay. So that sounds great actually. And we have a talk, we do talks every second Wednesday as well on Instagram, Real Women, Real Stories. Also where women get to basically talk about their stories and how they're dealing with infertility. And also it's a way of bringing hope, you know. So it's very much the same. So thank you for that. It sounds absolutely
Well, you
awesome.
must keep on going with that because, as I said, even if you start up a diary, you know,
Yeah.
write your own diary, it's also a very good way of get stress release as well during your treatment plan as well.
I was actually, that was going to be my next question. I was actually going to ask, is it good to document, you know, your whole treatment or just how you're feeling emotionally and things like that when going through this? So yes, it's good.
Yes,
So
I think
you
it's it's
answered.
it's 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 uh, it's how you know we our all thoughts is the process that people are working. You know, that's our whole environment is thought
Yeah.
processes. And I said to notice your own thoughts and feelings is the first fundamental thing, to notice it. You don't need to judge it or engage with it, but at least when you notice I've got these feelings and not ignore it or suppress it,
Yeah.
that's where things went wrong. So document is very good to get that outlet of that specific feelings and thoughts. And I think what we also say to couples is where sexual intimacy, there's different forms of intimacy in a relationship. There could be emotional intimacy or uh, intellectual intimacy as well. But I always said like the sexual intimacy is like the cherry on the cake, that you can't just build a relationship on that, but it's so important to fulfill that
Yeah.
closeness with your partner. So even here, you can try to make a date during the week and say, okay, I'm going to write the meaning of fertility for me. And he also needs to write down the meaning of infertility for me, and go to a restaurant and just read to each other, the little letter, and say, just take notice. That's at that stage, what is the meaning for me? Don't
Okay.
overanalyze it, but just take notice of each other. And that's for me very important. The infertility patients want to be here. They want to be
Yeah.
here. That people know they struggle, and yeah.
Okay. So once again, I'm not lying. I'm actually going to show you. That was my next question about couples. You've just answered it. So well done. So what you just mentioned, like, couples should just, take a little more time out to themselves, because I was going to ask you, what can couples do, to get through it together?
Yeah, I think research show us that 1 out of 2 of our couples sometimes not making it because
Yeah.
of stressful events that and how we internalize the diagnosis differently, specific where there's male fertility. Guys withdrawn completely, and
Yeah.
we call the pulling and pushing factors that start to be in a relationship. As soon as a guy withdrawn, what is the message that my wife is getting? She's getting the message, maybe you don't want children or you're not in love
Mm.
with me anymore. But that's not
Yeah.
actually, it's actually a messaging of struggle with my own masculinity.
Yeah.
And I think that's what it's so important to open up these things from the beginning. In our clinic specific, we give information sessions for our patients before they start with treatment. There's a lot of room for improvement, but that's something we started up here, that before they start with treatment, that they know how men and women differ in seeing the fertility treatment, how they use different languages, that at least they understand that it not ended up by I'm the only one that's going through it and you're not, that
Yes. Yes.
kind of pulling and pushing factors, that we can support them all the way. I'd also try to put sometimes a little bit of fun into that,
Yeah.
to with your fertility treatment, that you also put a little bit of humor in it, and that make it easier to handle it if you can. And
Yeah.
then I think also very important to put up boundaries between couples, and boundaries with that term, the extension families, or the outside world that's going to ask you
Yeah.
relax and things, but how you can put up the boundaries and talk about it, that you feel safe, that people not give you funny faces, or you feel that you're outcast of something different.
Yeah. Okay. So my last question is, does when it comes to when you're going to Wijnland Fertility Clinic and you're going to have your treatment there, do you take each and every couple that basically walks through your doors and first do a session with them, or is it does it depend on what it is that
We only, we only try to do with the IVF treatment plan to do the information sessions. It's quite a hard time and busy time for all, because they see me, and they also will see the nurse and the IVF coordinator, and they will see embryologists, and then we try to explain them what's going to happen during the treatment plan. If something would happen, like really disorders where people really struggle with depression and anxiety, or other severe things like sexual abuse, of all that kind of thing, we send them out to clinical psychologists to support them on the outside.
okay.
But I think here is just, so we hopefully hope that we can start from after the diagnosis, that we can take people by the hand. But at the moment, as we just do with the IVF treatment, we start with the information systems, and it helps a lot. It makes it easier for them. They feel quite safe during the treatment plan, and more relaxed, and because they exactly know what's the next stage of treatment plan, what's going to happen.
Okay, I'm just checking if there's any comments on for this. Okay, so I am getting messages, but they're going to ask privately. They would like to ask us privately, the comments. So if you guys want to ask anything, please inbox us or pop us an email. Lizanne, can you please give us your details of how they can contact Wijnland Fertility?
Right, they can contact us at our website. That's as it is www.wijnlandfertility.co.za. But we also, if you want to pop in an email, it's info@wijnlandfertility.co.za. From a personal point of view, I'm not doing therapy sessions at all. But if you want to be part of our support groups, you can also
Yeah.
email info@Wijnland Fertility. It's open for everybody. It's just support groups. And then actually we try to let support groups help each other. There's more than our support group. From our support group, there's also more support groups that started off in different towns and things. And then so that's it. You want to get
Okay,
hold,
great.
and I'll always give for free advice, because I was, as I said, did the study of the psychological aspects for many years, follow up the fertility patients, and it's my passion. So is there any advice or support I can give, you more than welcome to contact me as well. And that's also at info@wijnlandfertility.co.za.
Okay, great. Thank you very much, Lizanne. It's been very informative. And the ladies, you can hear that it's not, we are not going crazy when we're having the anxiety and going through all these things. It's real. It happens. It's bound to happen when dealing with this. But there is things you can do, and there is support groups out there, especially for those in Cape Town area. Wijnland has great support groups, and you actually get to cook and do herbs or plant or something like that. That's exactly what I saw. And I thought, oh wow, that looks actually interesting and so much fun. So thank you again for taking your time out to actually do this talk with us. Thank you, and have a great week in Luzon.
Always thank you, and it's always nice to talk to you, because I know it's very close to your heart as well to support the
Yes.
patient. So thank you for that as well. Bye
Thank
bye.
you, Luzon. Bye.